Hello guys, welcome to SKK Classes NZ again. So as in our previous video, we have discussed about fatty liver and what are the main types of fatty liver, and we also discussed about the signs symptoms of fatty liver. And today we are going to focus on the non-alcoholic fatty liver disease, because in our previous video that we have already discussed the alcoholic fatty liver diseases, that what it is. And today our main focus is on non-alcoholic fatty liver disease. So let's discuss about this as well as the treatment of the fatty liver disease. So whenever we are talking about the non-alcoholic fatty liver disease, I think it's already cleared from the name that this disease is related to those persons who are not taking the alcohol, but still they are having a fatty liver. Because this question always arises in every person's mind, that we are not taking alcohol but still we are having a fatty liver. Because this is just a misconception in some few in the minds of people, that the person who is taking alcohol, he or she should have has only fatty liver disease or having a fatty liver. But this is not right, because if the person is not taking alcohol, he or she can develop fatty liver. Okay, and this fatty liver, you can say the non-alcoholic fatty liver disease, that is related to your dietary habits as well as your lifestyle changes. Now the question arises that what are the main causes that can lead to non-fatty liver disease. So the main cause of non-alcoholic fatty liver disease is quite unknown, but there are some risk factors like obesity, gastric bypass surgery, then dietary habits, high cholesterol, and if the patient is suffering from already type 2 diabetes mellitus, so those persons can develop non-alcoholic fatty liver disease or fatty liver. And if we talk about the sign symptoms are quite same. The patient can feel fatigue, pain, weight loss, or maybe weight gain, and inflammation of liver is there. Then scarring of liver, that is cirrhosis of liver, can occur. So sign symptoms are quite same as the alcoholic fatty liver disease. So, whenever we are talking about the treatment of the fatty liver disease, whether it's alcoholic or non alcoholic, the main priority that should be given just to stop the alcohol. If the person is developing a alcoholic fatty liver disease, okay, so first you have to stop the alcohol so that your liver condition will not gonna worse. Then if the patient is obese, okay, then the weight loss management should be there. And if the patient is suffering from diabetes, so according to the you can say sign symptoms, and according to the problem that the patient is having, doctors will do that type of management according to the patient condition. So actually normally there are no medical or surgical treatments for the fatty liver, but some steps that should be taken to help or to prevent or to reverse some of the damage of the liver. In general, you can say that if you have a fatty liver, okay, and you should lose weight, okay, if you're obese, that should be a safe point for you. So it usually means that losing no more than half to 1 kilogram a week, okay, means you have to lose the weight gradually, not suddenly. Okay, because if you suddenly lose the weight, that will also leads to some problem. Because in fatty liver disease, just a symptomatic management that should be given to the patient, but the main management that should be focused on your dietary habits, that what you are eating if you are having a fatty liver. So okay, because if your diet will not be proper, so condition your health should be worse. Okay, so now see in this picture, this is a type of food that can help to clean the liver if you are having a fatty liver. So what type of food you have to eat? Like grapefruits, beets, carrots, green tea, apples, broccoli, lemon, walnuts, cabbage, cauliflower, avocado, spinach, garlic, turmeric. So these are the main foods that can clean your liver, or you can say detoxify your liver, so that your condition will not be gonna worse. Now I have to clear you that there are some foods that you should avoid if you have already developed the fatty liver. So what type of those foods are? Let's discuss about those foods. Now see in this picture, there are some key points are given that what are the main foods that can increase the non-alcoholic fatty liver disease, like beef, if you are taking lot of cold drinks. So these are the foods that can increase the risk of the non-alcoholic fatty liver disease. And what are the main foods that can decrease the fatty liver? That are like avocado and walnuts. Okay, and there's a gray pattern that should be given. This type of food will not affect the non-alcoholic fatty liver disease, like orange, egg, okay, rice, peas, fish. Okay, so these are the foods, they are having no effect on the fatty liver disease. But if you're taking like junk food, okay, you're taking lot of snacks, all the you can say packing food, that can leads to increase the risk of fatty liver disease. So these are the main foods that you have to take, and you have not to take in the fatty liver disease. Just focus on, and if you are having a fatty liver disease, try to drink water as much as you can, just to detoxify the liver. I think now it's very much clear to all of you that what is fatty liver and what are the main types of fatty liver. And I think now this conception is also cleared in your mind also, that fatty liver, that is not only associated with those persons who are taking alcohol, but it is also associated with those persons who are not taking alcohol. Okay, means if you are not consuming alcohol, you can develop fatty liver just due to your dietary habit pattern. So try to avoid junk food, try to avoid packed food as much as you can, and try to take green vegetables, more and more fruits, and more water as much as you can, so that your liver condition will not get affected. Okay, so thank you for watching SKK Classes NZ, and don't forget to subscribe my channel on YouTube. Thank you.